The title of my project is Incidence of Neurologic Findings in Esophageal Atresia Cohort at a Single Institution, a Retrospective Analysis. My name is Atresia Evanovich, and I'm a current medical student at Tufts University, and I'm a former Picari intern at Boston Children's Hospital under the mentorship of Dr. Atresia Evanovich, who was the principal investigator for this study. Esophageal atresia is a rare congenital anomaly, but is one of the most common gastrointestinal birth defects. There's a gap in our knowledge regarding the impact of perioperative critical care on neurodevelopment in infants born with esophageal atresia. Recent literature suggests that infants born with esophageal atresia could be at risk of incidental brain findings and long-term neurodevelopmental sequelae. The aim of this study was to quantify the incidence of neurologic findings of infants born with esophageal atresia at a single institution. We conducted a retrospective analysis of term-born and preterm infants that underwent primary surgical repair of esophageal atresia at our institution. Our retrospective analysis was conducted from 2009 to 2020 of initial repair of esophageal atresia at the Esophageal and Airway Treatment Center at Boston Children's Hospital. Endpoint data collection included A, incidence of neurologic diagnostics, ultrasound and MRI, and B, neurologic findings in patients born with esophageal atresia found in the first year of life. Collected data in the first year of life were classified to 1, vertebral and peripheral nervous system, and 2, the brain and cranium areas. Only 1/5 of cohort patients had esophageal atresia together with chromosomal or genetic abnormalities known to be associated or potentially associated with neurologic findings. As seen in the table below, 7% of patients had chromosomal abnormalities with known associated neurologic findings such as Char syndrome, trisomy 21, trisomy 18, Charcot-Marie-Tooth disease, and Dandy-Walker variant, whereas 10% had genetic abnormalities with possible neurologic findings such as 4p duplication, 6q deletion, 16q deletion, etc. Of note, majority of patients had no known chromosomal or genetic abnormalities in this cohort of patients. Half of the infants without chromosomal or genetic anomalies had some neurologic findings. Panel A represents a total number of esophageal atresia patients with vertebral and spinal cord findings and brain findings by gestational age. Panel A prime shows the incidence of vertebral and spinal cord findings and brain findings in term-born and preterm groups. We report that although there is a higher incidence of neurologic findings in the preterm groups, there was a significant incidence in the term-born groups with nearly 40% incidence of vertebral and spinal cord findings and a nearly 20% incidence in brain findings. Of those infants with identified neurologic findings, only 13% had co-occurring vertebral and spinal cord and brain findings, as seen here in Table 2. Interestingly, half of the patients had no reported neurologic findings, as shown here. In summary, half of the patients born with esophageal atresia might be at risk of neurologic findings. In esophageal atresia group without chromosomal or genetic anomalies, all patients underwent spinal diagnostics as part of the routine care of esophageal atresia in order to rule out Bacterol syndrome. The spinal diagnostics that were performed found vertebral and spinal cord findings in 41% of patients, as shown here. In esophageal atresia group without chromosomal or genetic anomalies, 21% had brain findings, but only half underwent brain diagnostics. This is unlike spinal diagnostics, which had 100% of all patients without chromosomal or genetic anomalies undergoing diagnostics. Therefore, it is possible that the true incidence of brain findings is underrepresented in our reporting here. Of the brain findings that were detected, there's a wide array of findings from benign, such as cysts and increased CSF volume, to more complex, such as agenesis of the corpus callosum and intraventricular hemorrhage. The majority of found brain findings were increased CSF volume at 10%, as shown here. In esophageal atresia group without chromosomal or genetic anomalies, infants with neurologic findings are not sicker by the pediatric risk assessment scoring. The table to the left shows PRAM scoring criteria that scores patients from 0, the least risk, to 13, the highest risk. We plotted the PRAM scores to the neurologic findings in this cohort in the graphs to the right. Panel A shows that there's wide PRAM score variability by gestational age, term-born and preterm patients, in both vertebral and spinal cord findings, with both groups being from PRAM 3 to 9. And in brain findings, with term-born patients being scored from 5 to 8, and preterm patients having a PRAM range from 3 to 9. Panel B shows patients stratified by type of surgery for esophageal atresia, with direct anastomosis representing an end-to-end anastomosis of existing esophageal pouches, whereas Fokker process represents an operation that necessitates traction suture placement and induction of esophageal lengthening prior to primary anastomosis of esophageal pouches. A similar trend of wide PRAM score variability is seen in vertebral and spinal cord findings for direct anastomosis from PRAM 3 to 9, but from PRAM 5 to 9 in Fokker process patients. In brain findings, direct anastomosis patients had a PRAM range from 4 to 8, and Fokker patients had a PRAM range from 3 to 9. This study is a novel report of incidence of neurologic findings in infants born with esophageal atresia based on retrospective analysis at a single institution. Our conclusions are: 1, evaluation of vertebral and spinal cord findings in infants born with esophageal atresia is part of routine care. However, neurologic evaluation of potential brain abnormalities is symptom-driven. And 2, presence of significant brain findings in infancy and unclear neurodevelopmental outcomes calls for closer monitoring of neurologic development during complex perioperative critical care of infants born with esophageal atresia. Thank you very much for your attention, and I'm happy to take any questions now.